Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of an earwax removal procedure performed just today on a young child, 4 years of age. And this is their right ear. I actually performed the left ear first, and that was the more complex one. But for the purpose of the video, I've just switched them around. Now, this child was amazing. He was so still, so brave, and it was somewhat funny as well because the child was sat on his father's lap on our ENT chair whilst I was performing the procedure, and he nodded off. It was just unbelievable, and bless him, he's got a bit of nasal congestion. And you'll see actually the patient's got eustachian tube dysfunction and glue ear, so he's actually got fluid behind his eardrum, and that's due to his nasal congestion. He's got enlarged adenoids, and he's just waiting for them to be removed. And that led to the patient, it's not only snoozing off, but it was a bit of snoring as well. And it was just incredible how still he was and unaffected by the noise. At the time of booking, the patient's father who booked we always ask, so when children are booked in, the parents obviously always ask is it possible to remove the wax in the child, and do we treat children? And we always say, as long as the child's still or still as possible and they're not moving around too much, it won't be a problem. And the patient reassured my clinic manager at the time of booking that his son's very still and it wouldn't be a problem. Now, you can see I've removed the wax. There's just some remnants around the edge. I'm just going to mop up. And you're going to see the patient's eardrum, which is dull and it's inflamed and it's retracted. And the white object there, I'm going to circle it when I do the left ear. That's what we call the lateral process or the short process of the hammer bone. And that's protruding outwards. And that's because this eardrum is sucked inwards and it's wrapped around the hammer bone. And that's why it's the hammer bone where I am now looking at the tip. The top white part of the bone is exposed. So quite often children with nasal congestion, it's very common within that age group. They're picking up bugs and allergies of their friends at school, and it can lead to nasal congestion, which can block the eustachian tube at the back of the nasopharynx, and of course if you've got adenoids that can also contribute towards that. And the eustachian tube connects to the back of the eardrum, so it helps to ventilate the middle ear, which is the cavity behind the eardrum. And it's also a drain pipe, so any fluid that collects behind the eardrum, it can drain out of the middle ear, because we don't want any fluid there, through the eustachian tube into the back of the nose and throat. But the eustachian tube is blocked. Now, it's quite often misunderstood actually with the eustachian tube. The eustachian tube under normal resting state is actually closed. And the reason for that is that we actually want the eustachian tube to be closed wherever possible, because it prevents you from hearing your own voice and your internal respiratory sounds, for example, travelling up the eustachian tube and stimulating the eardrum from the reverse, on the back end of the eardrum. And also the eustachian tube being closed by design, by default, helps to prevent any upper respiratory tract infection travelling up the eustachian tube and then infecting the middle ear. So the eustachian tube is normally shut, and during the course of the day, involuntarily, you're not aware that you're doing it. The eustachian tube opens by itself, generally caused by jaw movements, so yawning, swallowing, chewing. And during that brief moment, the air pressure equalises and any fluid that is collecting in the middle ear can drain out. But this poor child's eustachian tube is not opening, it's continuously blocked. And that's created a shortage of air. There's no air behind the eardrum. Any air that was left behind the eardrum has been sucked in by all the neighbouring cells in the middle ear. And that then creates a vacuum effect, and your eardrum gets sucked inwards. And eventually, if not resolved, fluid that would normally drain then also builds up. This fluid starts off very much like water, so it's a bit more runny, and it then gets infected and it becomes very viscous, almost like glue, hence the name glue ear. Now, this is the bit where the patient was just so amazing. We're actually on the eardrum here, and it's not often with a child that we are in the eardrum, and we're just going to be careful because we don't want to cause any trauma to the eardrum. And I'm just gently using the fine end suction tip here, and the patient was still completely still. sleeping, snoring away during this bit. Now, I've circled that bit. Now, that's the bit we've got to be careful of. That's the bone. That's the top part of the hammer bone, the short process. But you can see it's protruding outwards, but you've got this dead skin and wax just surrounding it. And we just be careful we don't touch that, because that would be very, very uncomfortable. So I just want to mop up a bit more from you if possible. So I'll just put a bit of drops in. And when I put the drops in, the child's eyes did momentarily open and looked across. And at the moment, I'm just trying to suction some of the excess oil. Because it can blur the screen, as you can see. So I just want to get rid of that blurriness. And you can already see at the top of the eardrum's sucked in. That's the retraction. So when the eardrum gets sucked in because of a blocked eustachian tube, it's normally the pars flaccida, which is the top part of the eardrum, which is less robust. You don't have the muscular layer like the pars tensor. So that eardrum, it's more flaccid, hence the name pars flaccida. So that part of the eardrum is more prone to getting sucked inwards, whereas the main body of the eardrum, the pars tensor, is a bit more rigid. Again, I'm just suctioning some excess oil. So we can see the majority of the eardrum already, and I did do a pressure test called tympanometry. Tympanometry assesses the efficacy, the function of the middle ear, and it can tell us whether there's fluid there, and it did confirm that the patient's got glue ear. They are already on the ENT waiting list with regards to the adenoids. In the meantime, I recommend some nasal drops for children. The typical nasal sprays are steroid-based and are not suitable for children. And we've recommended the Otovent nasal balloons. It's a balloon that you inflate using your nose. And so you block the opposite nostril that you're using it in, closing your mouth, you blow into the balloon, inflate the balloon using your nose. So the balloon comes with a nasal capsule, an inserter, and then as it inflates to the size of an orange, you just swallow, and it helps to force open the eustachian tube and pop the eardrum back out, and to allow some fluid to drain. So again, just right underneath that, the short process of the hammer bone. Again, there's a bit left around the edge. I'm not too concerned, but I'm just going to go back in the attic. I'm just going to have a look in the attic region just to make sure there's no keratin build-up there. We don't want to make sure there's no cholesteatoma forming. A cholesteatoma is when dead skin that normally sheds and migrates off the eardrum can collect in that pocket at the top. And you can see there's a bit of skin there, but it's actually it's not in the pocket. You can see I'm having a really close examination there. And it's not embedded, so it's kind of self-migrating, which is good. So it's just a little bit around the hammer bone. Now there's very little space there. I can just about insert the fine end just in that little gap, and I can't really go any more. And you can see the short process there, and the hammer bone is really sucked in. The umbo, which is the part of the hammer bone that connects to the middle of the eardrum, so it's almost like the bullseye that's not even in view. It's so sucked into the middle ear. I hope you enjoyed that video, guys. Do take care, keep well, and remember, be nice and be kind. Thanks, bye.